Barnyard Language. We are Katie and Arlene, an Iowa sheep farmer and an Ontario dairy farmer with 6 kids, 2 husbands, and a whole lot of chaos between us. So kick off your boots, reheat your coffee, and join us for some Barnyard Language, honest talk about running farms and raising families.
In case your kids haven't already learned all the swears from being in the barn, it might be a good idea to put on some headphones or turn down the volume. While many of our guests are professionals, they aren't your professionals. If you need personalized advice, consult your people. And welcome to another episode of Barnyard Language. We're going to do things a little bit differently today. Instead of our usual intro, you don't get to know what happened in Iowa or Ontario this week. You're going to have to save that till next week. We're going to do a little mini interview where I talk to Katie about some things that actually ended up coming up in the episode that follows. So it's a little bit backwards, but you're going to find out some context that is going to make the interview make more sense. And as a trigger warning, we're going to talk about some heavy stuff in this episode. So things like cancer and the possibility of a termination of pregnancy and some other stuff. So if those things are sensitive to you, if you don't think that you're in a place where you can talk about those things, or sorry, we're talking about them. If you can't listen to them right now, then that's okay. You can skip this episode and join us again next week. So Katie, how you feeling about this?
A little nervous. Last night, preparing for this, I was supposed to have made you an outline of questions.
Yeah, I'll figure it out.
So no, you're on your own, whatever. I pulled out my notes from the situation that we're talking about and then Googled a couple things, and when it came back with the first result with, is this situation a death sentence? I shut it down and figured you could just figure out what to ask me.
Yeah.
On your own.
So I'm on my own.
You're on your
with
own.
You. So I guess I know bits and pieces of this story, but I haven't actually heard it from kind of start to finish in a continuous story. So we're going to try and make it a little bit that way. So what time period are we actually talking about in your life today?
We're talking about, so to begin at the very beginning, like the Sound of Music, as it were, since we're, alone together. I had the girl child after 4 years of fertility treatments, and she was born in December of 2016. And when she was 6 months old, our doctors said, if you want another baby, you might want to start trying right away because it might take another 4 years. And I got pregnant the first month. So when I was 6 or 7 weeks pregnant, I was at a routine doctor's appointment, and for anyone who hasn't seen me, I'm real pale and real freckly. And when the dermatologist asks about things like blistering sunburns, I generally just laugh. And I'm a farmer, so we're not great about sun protection or anything like that generally. Anyway, I was at a routine doctor's appointment with my doctor, who we're interviewing today, my family GP. And I said, hey, I have this mole on my arm and it looks different. And it seems like it's growing faster than I would anticipate. And it turns out that during pregnancy, the same changes to hormones that allow a baby to grow also allow tumors to grow very quickly and very aggressively. And so this thing had doubled in size in a few weeks and didn't look like anything scary, but, note for everybody, anything that's changing on your body should be looked at. That is just a strong better safe than sorry. So my doctor said, well, I'm sure, if it's anything, there's 3 types of skin cancer and 2 of them are pretty, we cut it off and then you just go on your merry little way. And then there's one that is, until about the last decade, has been a death sentence, because it does not respond to chemo or radiation or anything like that. So the doctor said, we'll biopsy this and send it in, and not my first skin biopsy. And so I expected it would be a week or 2, and I'd get back a, it's a weird thing like all the other weird things sort of result. And instead we had Jim and the girl child and I had gone to the fertility clinic for our ultrasound to prove that the boy child was a viable pregnancy. So like as happy as we could possibly be about this whole situation. Literally walked out of that appointment, went to the Habitat Restore, and got a call on my cell phone from my doctor's cell phone, which is not ever going to be good news. And, I had anticipated it would be at least a week before I got any results, and it was just over 24 hours. And she called to say that I had melanoma. And with skin cancer, it can't be staged until they cut it all out. Like, the general treatment for melanoma is to cut, and they just keep going until it's gone. There are some new immune therapies coming out that have shown great promise, but it's a very hard thing to treat, and skin cancer is treated very much as a minor thing, but your skin is your largest organ, and it turns out that it is very important to have skin.
Yeah.
It's
right.
not something you can remove.
I'm going to backtrack a little bit just for context. What size of a thing are we talking about? Was it, like we were using coins? I mean, Americans like to use football fields. Clearly it wasn't that big, but like what made you what made you notice it, and kind of what size are we talking about? I'm just thinking if someone sees something on their own skin that they're worried about, what did you see?
Yeah, so that was part of the whole confusion. I mean, obviously my doctor knows what a typical melanoma looks like. They're generally very dark. They're generally big and uneven and fucking gnarly looking.
You can Google that.
Don't. Well, I mean, do, because it's good to know what they look like, but be prepared, because they're generally pretty damn ugly. The one I had was smaller than a pencil eraser and fairly white, which is generally pretty abnormal because melanoma is actually a cancer of the melanin cells that make your skin whatever color it is. And it had started, like, it had grown quite a bit and it was bleeding, which is, if you have things on your skin that are bleeding just kind of by themselves,
that's also a
go to the damn doctor. That skin biopsy is not nearly as bad as ignoring whatever that thing is. So, generally, good rule of thumb, mostly with things on your skin, if they're asymmetrical, if the borders aren't clear, if the color's weird, the diameter's bigger than a pencil eraser, and it's evolving. So if it's changing, those are all bad signs. And it is really important to check your skin, especially your scalp, your back, the bottoms of your feet. So anyway, had a thing that was totally atypical for being anything. And it was definitely
So you get the call from your doctor, and so your very good day takes a bit of a turn. And so what is the next step from there in that moment? What did you get told, or where were you headed next?
The staging for melanoma involves a lot of how invasive it is. Mine was deep enough to be stage 2, but without further surgery, they can't tell if it's involved the lymph nodes or if it's invaded your organs. And these are the problems, is that melanoma spreads by basically breaking off tiny bits of cell clumps and just sort of doing its thing. So the other thing I found out is that I can no longer donate blood because it is technically transmissible. I can't donate organs because, again, technically transmissible. And most importantly for me, it can be passed through the placenta, which means that my baby was at high risk as well, because it can be passed through the blood. So it's not, it's not technically contagious. Like, you're not going to touch the blood from someone with melanoma and, like, immediately grow a cancer, like, bleh. But, but still, they don't really want to inject it into somebody. Yeah. The issue being that because I was so early in my pregnancy, the surgery to remove the lymph nodes to look for cancer, they use injectable dyes to track which lymph nodes the tumor is draining to. And that dye in particular is not at all safe during pregnancy. And so the like sort of the real highlight of the whole thing was that the best, safest for me option that we were given was to terminate immediately and do the surgery. But because tumors respond to pregnancy hormones by growing at such an exceptional rate, we would not be allowed to have another baby. And, you know, with one baby at home and only being 7 weeks with the other, but with no guarantee as to how bad the melanoma was. You know, I mean, it was unlikely to be anything really horrific, but it also shouldn't have been melanoma in the first place.
Right, and it wasn't presenting in a way that seemed typical, so it didn't seem like anything was typical about what was happening.
Yep. So the first option we were given was to terminate immediately. And this was during the same time that the state of Iowa was trying to pass a 6-week abortion ban. So that, you know, they make a big deal of, well, you know, there's exceptions. But to have this ban being discussed at a time that I would have already been far enough along that I would have had to get the state's permission if this ban had passed. You know, with no regard to my doctor or my family or any of the other doctors. Before I was transferred to Mayo, I think Coley said that there were 25 different medical professionals consulting on my case. So the idea that the state would have had the right to tell me what I could and could not do with my own body for a baby that we wanted so badly was really offensive. Like there's no better way to put it. And I am generally pretty pro-life, you know, but at the same time, until we give families the support they need and we deal with the fact that shit happens, you know, I kind of think that we should be trusting families and their medical providers to make these decisions.
So you had, obviously, from your own doctor, went to a team of people who were consulting on what was next. At what point did you decide that termination wasn't an option for you?
So the next step from there was to do genetic testing to make sure that the baby wasn't carrying anything that might influence our decision. And he wasn't totally healthy. And from there, we basically just talked about the odds of whether it was likely to be a nothing or whether it was likely to kill me, and whether, if it was that bad, if it was likely to kill me before the baby came. And I didn't, you know, I mean, the boy child is now 5 last week, so it's been quite a while, and I'm just now realizing that at no point was I really worried about my health or the risk to myself, except as whether I was going to leave my kid without a mother, or whether I was going to leave 2 kids without a mother, or whether I was going to terminate a pregnancy that we wanted so much and then find out that it was relatively nothing, you know, without the choice to have another one. And the surgery was not safe until I was into my 2nd trimester, so we had 2.5 months of waiting and hoping that it wasn't, you know, spreading all over my body or something.
So when you talk
horrible.
about surgery, that was to remove...
Honestly,
what was visible and what was underneath the skin in that spot, but they weren't going to be able to do the investigation of lymph nodes or anything like that until later. Or what was the surgery they were talking?
They did the whole thing at once because into the second trimester, the dye gets a little bit safer. And I was transferred to Mayo Clinic because they're able to do it. Normally it's done with 2 kinds of dye, and Mayo Clinic is able to do it with 1. Still not super safe, but, better than waiting 9 months to find out what's happening. So they did what's called a wide local excision, which in my case was, it's a football-shaped chunk about 3 inches long, and I think about 3/4 of an inch deep. And so for quite a while, it looked like a shark bite out of my arm because it goes down into the muscle and just takes everything because they have to get a clear border on everything. And then they removed 2 lymph nodes from under my arm at the same time. And thankfully, they were all clear. So I am now 5 years out, which means that I am no longer doing every 6 months with the dermatologist. I still have to go annually, but for a while it was every 3 months. And if anyone wants to know why I have no sense of privacy or shame or anything, especially at Mayo Clinic, they photograph you for skin mapping, and normally I would anticipate being paid very well for photographs of that nature. Let's put it that way. It is very thorough. At this point, talking about my fertility treatments is like, meh,
Yeah.
There's no photos. So, yeah. And to have it, obviously to have everything come back clear at that point was the best possible news. But to be treated like that just meant that it was all fine and dandy, with no regard to what the last 3 months had been like, was really harder than I expected. It turns out that there's such a difference between being cured of an illness and being healed. And that's one that's going to take quite a while, and there's no getting through it faster.
You talked before about looking at the odds. Do you remember what the statistics were like? Like what those discussions were like when you were talking about what the chances were and how you made a decision based on, it was based on science, but also based on so many unknowns.
I stopped Googling before I got to those odds last night because I Googled when it was diagnosed, and it was not helpful. It's not a good rabbit hole to go down. My risk of reoccurrence is still quite high because I'm relatively young. Melanoma used to be an old white dude's thing on their nose from playing golf or driving tractors. It is now rapidly becoming the most common cancer among women in their 30s and 40s because of tanning bed usage and things of that nature. The numbers are getting better with immune therapy, but generally it's not so much what the risk is of it being a bad stage, but what the risk is if it is a bad stage. It's very unlikely to be worse than a stage 1 or a stage 2, which is just that it has not spread beyond the original tumor, that it's not into your lymph nodes, it's not spreading through your body, whatever. But if it has spread, even the 1-year survival rate is real bad. And especially having the girl child, be 16 months old, the thing that was absolutely the scariest was that she wouldn't remember me because she'd be too young. And so that honestly is a lot of why I do this podcast, because it leaves something. And I mean, I have gotten through this part of the melanoma. It could come back. An airplane could fall out of the sky and crush my house with me in it. Like, there's, none of us are ever given any guarantee, but the idea that my kids could be raised with just what other people could tell them about me, it's terrifying. It's, now they're old enough that they probably remember how weird I am. And we take a lot of photos and we take a lot of videos because that was absolutely the scariest part.
And it's not something.
Look at me like getting all emotionally.
It's not something most of us have to think about at that time, though. Like, when I was pregnant, I was very focused on myself, kind of, I guess, similar to what you said, in the sense of like making sure I was healthy and, eating the right things and doing the right things because I was growing a baby. And it was almost, outside of yourself in terms of like, it's not really for me, it's for my child, but having to make those types of decisions while also growing another person is huge. Can you talk a little bit about the decisions in terms of what that was like within your relationship and how your husband coped with that time? Or is that something that is out of bounds because that's his story to tell?
It's not out of bounds. I think Jim is a much more everything will be okay kind of person than I am. And I think we're both kind of in that position of we can't think about what will happen if it's not okay, so we're just going to assume that it will be. But it's different when it's your body. And one of the things that was really hardest for me and took the biggest toll on our marriage was that he understandably and rightfully didn't want me to feel like he was pushing my decision one way or the other. But that also feels very much the same as not being supported in making the decision. And probably if we hadn't been coming off so many years of the same sorts of issues with the fertility treatments and having a high-risk pregnancy with the girl child, it might have been very different. But it's been a long road, and that emotional toll was a lot more than I had anticipated, because nobody else can be in it with you. And being a person who struggles with letting anybody else into my struggles anyway, and then literally being in something where nobody else can help you with it. And feeling like, my doctors did a great job, but when you get sick or something goes wrong, you anticipate that you'll go and they'll fix it. That is literally what they're supposed to do. And so too, realizing that as I've become friends with my medical providers, because we spend a lot of time together and we live in a very small town, the level of frustration and fear that must be like for them to deal with not being able to fix it. People become doctors because they want to fix shit. And that lack of control was really the big one, I think. And the upside is that my doctor did actually have another pregnant woman came in with a weird skin thing a couple months later. And she said, normally I never would have biopsied it because you're not the target demographic. It didn't look like a melanoma. And it turned out that that woman also had melanoma. But it was much more straightforward for them to deal with because they had just done it with my case. And thankfully she was further enough along that it was able to just be dealt with right away. So
it is a whole thing.
It's a whole
so
thing.
after surgery, Was the remainder of your pregnancy, I hate to use the word normal, but was it typical? Were there any other things that you needed to monitor, or once they kind of had determined that it hadn't spread to your lymph nodes and they had removed the cancer, did things kind of go along as normal, or were there extra things that needed to be?
There were extra things, but none
Okay.
of them really had to do with the melanoma. I had insulin-controlled gestational diabetes with both kids, which started 3 weeks earlier than is physically possible.
Of course.
With the boy child. You're not supposed to be able to get gestational diabetes until 9 weeks, and I was back on insulin at 6 weeks. Upside of seeing a very small medical practice, and especially back-to-back pregnancies, is that nobody doubted any part of it when I came in and said
They
my blood
remembered
sugars
you.
were high. My blood pressure also went through the roof, which,
You
stress
don't say.
levels. I don't know. We have
Yeah.
a 16-month-old at home, and I'm like doing cancer treatments while pregnant. I don't know why I'm stressed. And it's, we're very, very lucky to have 2 beautiful, healthy children. But I also, had to have my tubes removed when the boy child was born, which thankfully I had a scheduled C-section, so taking your tubes out at the same time is pretty damn easy. But I haven't even started coming to terms with what it's like to spend so much time trying to get pregnant, and then to get pregnant really unexpectedly both times. I mean, we'd been hoping for a long time, but after that long of hoping, you don't expect it by any means. And then to have my choice of having more children taken away like that was unbelievable. And I mean, our family is complete with the children we have, and it feels very selfish to say, but what if I had wanted more, like more than the 2 babies that we weren't going to have, and more than the not dying of cancer while I was pregnant kind of thing, like. But to get that opportunity back and then to have it taken away again like that was very difficult, and especially when you feel like you should be grateful for what you got. And it's like, but everybody else just gets
and
to
it's
like
not that
have
you're
12
not grateful
kids and,
for your life, but the removal of choice. Go figure, not having choices.
Yeah. And then to be dealing with all of this during this abortion ban debate, and seeing just so much in the public discourse about, that abortion is for lazy, stupid women who are too lazy and stupid to use birth control. And to see no discussion of cases like ours, or cases where birth control fails, or or where the baby's sick,
or right?
whatever else happens. It's none of your goddamn business because you're not the medical team, and it's not your body.
So many reasons, and each of them is unique, and each of them should be treated that way, right? And like you said, that medical professionals and the people bearing the children should be the ones that get to make the choices over their bodies.
And especially in our situation, the idea that I was at the Mayo Clinic in Rochester, which we are very fortunate to live close to. It is one of the best cancer centers in the world. And the idea that the state government would have a panel not of specialists from the best cancer center in the world debating what was best for me and my family is like head explosion. Horrifying that that's considered a reasonable use of their time, or of mine, and that God knows how long it would take to get through their appeals process, and
it is a whole thing.
It's a whole
So,
thing.
on that note,
So,
why don't we go into our interview with Katie's doctor, Dr. Coley, and we're going to talk about lots of other stuff, but it felt like some context was needed for the discussions that ended up coming out of that interview. So, we hope that this, combined with our interview, creates some kind of a cohesive story, cohesive idea, some things to think about, and that you enjoy. I don't know about if enjoy is the right word, but if I hope that this episode makes you think and maybe is helpful to you in some way. So here she is. Today we are excited to be talking to Dr. Coley Barbee, who's a family physician in Iowa. We start each of our interviews with the same question, so this is a way for you to introduce yourself to our listeners, and we ask, what are you growing? So for our farming guests, that covers crops and livestock, but it can also cover families, businesses, career, all types of other things. So, Coley, what are you growing?
I am not at all a farmer and currently actively killing some basil. So
Perfect.
trying to grow. I'm not much of a gardener. I moved to Iowa and once I was here learned a lot about farming. I'm originally from Maine. There's a lot of aquaculture there, so I know a lot about the ocean and fishing. I know next to nothing about farming and am not a very good grower, but I try so hard. But my
Enthusiasm
sad,
counts for
sad
a lot.
basil. Yes, my sad, sad basil is kind of testament to my growing ability right now, I think. So I am currently kind of growing my skills in integrative medicine. I'm currently enrolled in an integrative medicine fellowship. So I have about 9 months left, and that has been a really good addition to my family medicine practice. So I would say I'm growing in knowledge and commitment to using kind of holistic ways of treatment and healing in addition to um, Western modalities, and that has been really exciting and interesting. I have about 9 months left in my program, and then I hope to be double boarded in family medicine and integrative medicine.
so can you tell us more about what integrative medicine is and why it's important?
Absolutely. Integrative medicine at its most basic really is looking at a person holistically. I think family medicine general does this in general does this pretty well. We don't look at people as being, just one body system. We look at you as a whole person, but integrative medicine is kind of taking that to the next level. So you are looking at people's um, exercise habits, eating habits, their family, their spirituality, the community that they're um, a member of. You are you use all of the conventional pharmaceutical medicines, but in addition to that, work on diet changes to help with certain health conditions, supplements, just a more holistic way of looking at medicine. So that's the brief definition. You could go very in depth, and there's a lot. It is a 2-year program that I'm doing, so there's certainly a lot to learn. But that's the basic explanation.
So, how did you end up in rural medicine, and how did you end up in Waukon, Iowa, for that matter? I mean, it's a nice town, don't get me wrong, but it's not like a hotbed of anything, really.
Yeah. So the reason that I went to medical school is because I wanted to do rural medicine. I grew up in a small town of about 1,000 people. It was also rural, kind of in the middle of nowhere. And what I noticed is it's really hard to cobble together a living in a rural area sometimes. And people's health suffers as a consequence. And one of the biggest factors that determines how healthy a person is actually the zip code they live in. I thought that was deeply unfair. And so the whole reason I went to medical school was to do rural medicine. I thought I might go back to Maine to do that, but it turns out the Midwest is really a great place to practice family medicine. You get to do a little bit of everything. And so I did my residency outside of Milwaukee. It was my first experience in the Midwest, and I really loved it. And I honestly had interviewed at a job that some of my residency mates thought that I might like the Prairie du Chien area, which is just across the river in Wisconsin. And I honestly said, well, if I'm going all the way out there, I might as well do another interview, and just literally like close my eyes, circle the finger, and like dropped in Waukon. And like, so very much on a whim, had never been here before, had never been to Iowa before. And when I came, I met the people who worked in the clinic that I now work in, and just realized these are my people. And just, I knew I wanted to work there because the group of people that I now work with, I just love. And I said, this is exactly the type of thing I want to do. And where I work now allows me to do a little bit of everything. I see patients mostly in clinic. I also see patients in the hospital. I do some ER work. Up until about 6 months ago, I delivered babies, and so I see a little bit of everything. I'm never bored, and am continuously happy that I moved here. Even though, if you'd asked me before I started here, Iowa would have been the absolute last place that I saw myself. But I love it here, and Midwesterners are very much like Mainers, so it feels like home.
Well, I have to say I'm incredibly glad that you ended up here, no matter how randomly it was.
Me
For
too.
our listeners who might not have guessed yet, Coley is the family physician that my family sees, and I have to say we're incredibly glad to have a family doctor that sees all of us for everything that we need. Coley delivered our younger child; she sees all four of us, and from an integrative perspective, it's amazing to see one medical team for everything, and who sees our whole family, who sees us for everything that we need, who's, even if we have to be passed on to a specialist, that we still have a team who knows us as humans. Because especially once you start getting shuffled up into larger facilities, you become a patient number in a file pretty quickly. And it's really nice to have somebody at home who knows you for something besides, what's in your chart. So there's that.
And I love seeing the whole family, and it is really a good opportunity for me too to, you might bring one of the kids in, and I'll just say, well, how's that thing we talked about last time? And it's a great way for me too, just to keep a good tabs on everybody, and make sure everyone's still doing really is healthy and doing well.
Yeah, and it's nice too to know that our children can see the same doctor as babies as they do as children, as they can as adults, hopefully. I know I saw the same doctor a few years ago that delivered my husband. Um, so he saw patients that whole time, and it's nice to have that continuity of care with the clinic, and especially if you end up seeing them a lot, like if you have a higher risk pregnancy or something, and you're spending a lot of time there, it's really nice to see the same folks. So we're going to start with some super in-depth, serious questions. First thing, do you notice or care if patients don't shave their legs? This is important stuff right here.
You know, I never notice, and people constantly apologize. Constantly. So I would say at least once a week, someone says, "Oh, I'm so sorry I didn't shave my legs." I'm like, "Oh my, like it's winter in Iowa. Do you think anybody is?" Like, no. So I honestly never notice that. What I notice more is people that I would expect to have hairy legs that don't have hair on their legs, because then I worry, oh, do you actually have a vascular problem or diabetes?
Interesting.
So I pay much more attention to that than I do people shaving their legs.
So what you're saying is we should not shave our legs so that you have a better view of our cardiovascular health?
I think that would be very reasonable.
Cool. I'm going to go with that. I like it.
Especially in the wintertime.
Yeah.
Especially.
I'm from Canada, so I don't want to shave my legs in the winter either.
Absolutely.
So the other thing that has come up in conversation fairly recently, why do we all hide our underwear at the doctor? we put on a gown and we fold our clothes and we always put our underwear like hidden in there. Like presumably you assume that we're wearing them. So why do we hide them? And do doctors hide them when they go to other doctors?
That's a great question. And yes, we absolutely do.
So,
I fold up the little packet
yeah,
just like everybody does with me. And I have no idea why. Just fold them up in the pants,
yeah,
tuck them on the chair.
it's so weird.
I have no idea why.
Yeah, I was talking to a friend about the fact that even like at the fertility clinic or like going in for OB appointments, that you still like hide your undies, despite the fact that your doctor's going to be like in there. And you're like,
Mm-hmm.
they can't know I was wearing underwear when I walked through the door. Like, I would think they'd want to know that you were wearing underwear. I don't know. Anyway. Okay, well, now that we've really hit the
Okay,
hard
yeah,
topics, we can move on.
that's the good stuff right there.
Burning question.
Yeah, for sure. So you already touched on the idea of well, I guess exercise and nutrition and those types of things, but one of the things that kind of comes around to is weight, which ends up being one of those things that gets talked about a lot, both in adults and children. How can we discuss weight as a possible risk factor when it comes to health, but also not shame people into thinking that all their health problems would just disappear if they were to lose weight? Because some fat people, their experiences with doctors is that their doctors won't even discuss their medical concerns outside of telling them lose weight first and then we can deal with it.
I think that's an excellent question. I don't think it's ever helpful or kind to shame someone for the way they look. I don't, and honestly, the conversation tends to shut down. If that's the first thing that you lead with, no one wants to talk about, well, how can I be healthier? But by the same token, like you said, obesity is a risk factor for a lot of other disease processes. And, in order to be healthy, being at a healthy weight makes it easier to avoid some of those down the road health concerns. But like you said, there is such a thing as skinny fat. So just because people have, a BMI between 18 and 25, which is what we deem normal, does not mean that they're metabolically healthy. There are actually estimates if you look at people's so fasting insulin levels is not a test that we do for very many people, but it is one of the most sensitive indicators if people are metabolically healthy, like they are processing their food and sugar in a way that, and how it's supposed to. And there are estimates that up to 90% of Americans are not metabolically healthy. If you look at those more sensitive indicators, which we are not really trained to do, really the functional medicine doctors do that more than pretty much anyone else. It's not very mainstream in Western medicine to test those things, but when they look at population-wide studies, most of America is metabolically unhealthy, and we know that leads to problems. But like you said, I don't think that you can't just look at a person and say you're metabolically unhealthy. You have people who maybe have an elevated BMI, but are very physically active and fit, and that makes a big difference. So I think it's a difficult and complicated question, and one that I think everyone struggles with. We all know that we need to do things to be healthier, so we have a long life and a long health span, but it's a lot easier said than done. And I don't think shaming people into improving their diet is useful or helpful. I think you really need to be open about it and have an honest conversation, but people need to be supported and not shamed.
I know, too, as a patient, it's a lot easier to address things like weight and healthy eating when it's seen as one risk factor in a whole array of things versus it's your fault because you're fat and that's the only thing we're going to talk about. And also anything else is probably because of your anxiety. So that's it. Problem solved. So one of the things that's kind of like a stereotype of rural medicine is that, the doctor would fix your kid or something and they'd pay you in, a patient would pay in chickens or whatever. So if we were just going to skip insurance and all that shit and go back to paying in trade, what would your preferred payment currency be?
Oh my God. I have said so many times, I would love to just work on the barter system. Because I feel like, we all have skills that we can offer. I'm not picky. I'll take anything. I will take the chickens. I will take the produce. I will someone wants to trade their skill in painting my house, like, I don't care. I just I love the idea of the barter system, because I do think we all have talents and gifts, and what a better way to share than just to offer somebody what you're good at in return for what they're good at.
So the actual harder hitting side of that is, I know that I've seen more articles and patients talking about, especially in bigger places, how much of their doctor's salary and career path is based on patient satisfaction and reviews, and how much that impacts what kind of care doctors give, because there's so much weight put on making people happy versus necessarily what is healthiest or most effective, or telling people no, or whatever. So I'm wondering what your experience has been with that.
Yeah, the incentives in medicine are so backwards. Like, insurance will pay for things that research has shown is not helpful. They will not pay for things that take a little more time and might be more expensive but work a lot better. They will pay for medicines but not physical therapy. Doctors are paid to perform procedures that are minimally effective versus, spending time to actually sit down and talk with patients, and give them an exercise plan and say, hey, this actually will fix your problem. But they don't get paid to do that. They get paid to do the expensive $20,000 surgery that may or may not be effective. So all of the incentives in medicine are so backwards. I would say, I think it is true that more and more places are going toward using, physician ratings and things like that as part of a compensation package. I don't think we'll ever get to the point where it's the only consideration, but it certainly is part of it, and I'm sure, like, we've all received the questionnaire once you leave your doctor's office. Tell us how your visit went, um, and the administrators really do put a lot of weight on your grade, I guess, from patients. Um, and it's sometimes really hard because, I mean, there's a lot of health information out there now, which I do really think is a good thing. I think informed patients coming in can be really helpful. But the flip side of that is there's a lot of information that isn't accurate, doesn't come from reliable sources, and it's hard, not being a medical professional sometimes, to differentiate between, what's what's good information from a good reputable source and what's not. And it takes a long time to kind of talk through people when they come in and say, I want this. And you have to say, well, in my medical judgment, I don't think that's a good idea, and here's why. But it takes a long time explaining. And when they want you to see more patients in less time, sometimes it's easier to say, fine, whatever you want. But I've realized anytime I've done that, I've only gotten bit in the ass. So I it's worth it to me to take the time to say, I hear you, I understand what you're saying to me, here's why I think that's not a good idea, and I'm not going to do it. um, Funny aside story, my 9-year-old stepson, we have this constant battle about screen time because there's all this research showing how detrimental excessive screen time is for developing brains. But he's 9 and he wants to watch TikTok and YouTube and play his video games. And so it's this constant battle. And, you know, we were negotiating recently, and he's like, oh, can I have like 30 more minutes a day? And I was like, you know what? Like, it can cause brain damage. I don't think it's a good idea. And he goes, Coley, you can't believe everything you read on the internet. Which I just thought was hilarious. And, but that's like the conversation that I have a lot of times with patients. They bring it to me and they say, well, but I read this and it has to be true. And it just takes a while to explain, maybe not a good idea. But I mean, I definitely have gotten poor ratings from patients who say, like, I went there and I wanted an antibiotic and she didn't give me one, and they're upset by it. And I try to explain why I didn't think that was a good idea. And some people take it well and some people not so much. I'm at the point in my life where I've realized you can't please everybody. So let's stop trying. We're all just doing the best we can.
Right. Well, I'm going to bump my next question up then. And I wrote these questions at 4 a.m. So at first it just said doctors versus patients, who's the bigger jerk? And I wasn't sure what I meant by that. But I'm realizing, I think, what I meant was that this is one of the other real benefits of seeing the same doctor consistently, is that it does make it easier to know when your doctor's saying no to something because it's actually not the best option versus I don't give a shit what you think and I'm the doctor and I'm saying no. So I'm wondering how we can enable more patients to advocate effectively while recognizing that doctors presumably know more about medicine, while patients presumably know more about themselves and what they're experiencing, and how we can do research without seeming and or being presumptuous jackasses about what we're finding when we do it. I know I do really appreciate that generally when I come to you with something I've found. I know there have been times that you've gone a different direction, but it's nice to know that I'm being considered before I'm being shut down on something, and it's nice to have the relationship where I trust that you are actually considering what I say, even if I'm totally full of shit, and we both know it, So I'm wondering how we can empower more people to have a good relationship with their medical staff.
I think I really like when patients come in with information. There's also this thing in medicine where even really good research takes, on average, like 8 to 10 years to trickle down um, to actual medical providers before it gets incorporated into guidelines and before we're aware of it. And so, I will never say, oh, I know everything about this subject matter, because I know that I don't. So I think the best thing patients can do is if you find, good research and a good source, I am always happy to look into it, because I know there's stuff I don't know. And but by the same token, someone coming in and saying, well, my great aunt Sally on Facebook says, doesn't hold the same weight as, look, I found this journal article, would you mind looking at it? So yeah, if I think bringing good quality research to your doctor is never a bad thing. And I will be being totally fair. There absolutely are doctors whose ego gets in the way and says, well, I know everything about this and I don't need to listen to you. So there are those doctors out there. I will not pretend that there aren't. But I think most of us, and I think especially most like primary care doctors who really do form long-term relationships with patients, by and large, most of us are very happy if you bring in, something, a good body, a piece of research that we can look at and say, oh, well, I didn't realize this, but this actually looks like a pretty good study, and that seems like a reasonable thing to try. I think that's the best thing for patients to do to advocate for themselves.
You've been talking a lot about having relationships with people, and especially in rural medicine, I mean, those relationships often kind of extend outside of the doctor's office, like, for example, being on one of your patients' podcasts. So what is it like for you personally to have to do things like give bad news to people that you know well, or, even, in a smaller scale, like maintain boundaries around, this is not a doctor's office. If someone asks you for advice in the grocery store versus like in an appointment, like how do you, I guess, how do you look after yourself being a rural doctor?
The grocery store questions happen much less frequently than I was worried that they would
Well,
happen.
that's good.
It is good. But it is a balance to be part of a smaller community, and especially with the giving bad news, and frequently the bad news is something like, oh, I think you might have a problem that I don't know how to fix, and you need to go see some specialist. You need to see oncology or surgery or cardiology, and a doctor or provider with a skill set that I don't have. So one of the hardest things for me is not not having enough information to give to somebody to say, here's exactly what the process will look like. Like if I have to hand a patient off to a specialist because they have something that I don't know how to deal with, or I don't have the skill set to manage. Yeah, one of the hardest things is I can't answer their questions all the time. I don't know all the steps that are going to come next. And um, so that's difficult for me, and I try to find out as much as I can before delivering the bad news, like, so I at least know the next step, like, we have this appointment set up for you and you are going to see the specialist, type of thing. um but it's challenging, and I like most of my patients, and I so it's never nice to give bad news to someone that you like. But it's just, fortunately I don't have to do it. Fortunately, I get to give good news more than bad news, I think. So
It's my question, isn't it? I was just over here thinking about bad news. Um, my next question just says access to reproductive care, WTF. Um, and I know this is something that's connected with the having to give bad news to people and being a patient who's been in that position with you. How can we? I'm trying to even think of how to put this. How can we effectively stop the government from inserting themselves in the doctor-patient relationship? When I was in the position of having to make these decisions, I don't really want the state's opinion on it, and I don't really want the state making that decision. When I was in the position of having to decide whether to abort the boy child for the safest treatment path for the melanoma, I don't really want to have to skip all the doctors that are consulting to go to a medical board at the state and get their permission to do something. So I'm wondering what your thoughts are on this and how we can tell them to shut it, because I don't. Canada is a different situation, but I'm sure they're not immune to these things either. So
this is a really difficult question, and one that I am very passionate about. Um, I feel all the time like all kinds of outside groups are inserting themselves into the doctor-patient relationship. The one I honestly have the most difficulty with is insurance companies. When I say this is the best treatment, and insurance company says, nope, sorry, pick a different thing. We're not going to cover this one. Um, and I don't have a good solution for that. And I also don't have a good solution for how to keep um, politicians and the state from inserting themselves especially into issues they don't understand, um, is the most frustrating thing as a healthcare provider. When I see the debates on abortion happening, and it is just blatantly false information, like we're just gonna we abortion doctors throw live babies into trash cans and all this other ridiculousness. I'm just thinking, who who thinks this is true? But obviously people do. So everything is so caught up in misinformation and just incorrect things, not based at all on medicine or science. That's what I find the absolutely most frustrating. So I keep telling people to vote, but unfortunately that's not being very effective. So I'm not sure. I'm not sure what the best course of action is, except for, as medical providers, continuing. I write letters to my um, representatives all the time. Every time they vote on something stupid, I write a letter and I say, here's why you're wrong. So I think that's a really important thing for medical people to do, because so many of these debates are completely surrounded by misinformation, and there are not very many healthcare providers in legislatures at the state or the federal level. So it's challenging because they're making laws on things that they don't they're not fully informed about, I don't think. So
It seems like that's so much of it too from a patient perspective, is if it seemed like they had any actual knowledge about what they were legislating on, and then they made a well thought out, informed decision, it might be different. But when it's people saying, if a woman doesn't want to get pregnant, her body has ways of shutting that down, and
yeah.
no abortions after 6 weeks when so many people don't know they're pregnant until well after 6 weeks, and this, that, and the other, that I'm just like, you guys, there's no actual basis in fact here. So no, I don't have a lot of faith in your decision making at this point. And yes, insurance
Yeah.
companies,
Well,
just insurance companies, whatever.
yeah, and there are so many other layers to providing abortion care. A lot of residency programs actually take place in Catholic hospitals, and so OBGYNs coming out of those programs don't even learn how to perform an abortion, or sometimes even like tubal ligations, because the Catholic hospitals don't allow those procedures, and so where they train, they don't learn how to do them. And there's a lot of barriers set up. So for instance, when I came to Wakan, I really wanted to so the mifepristone, which is commonly known as the abortion pill, it's actually one of two pills that you use for medical abortion, but you need to be specially licensed in order to prescribe it. So not everyone can prescribe it. So when I came here, I wanted to do that, and my employer basically said, well, if there are complications, you don't have the surgical privileges to do a D&C if there's bleeding or complications. So we're not going to let you get your license to prescribe mifepristone. And I said, well, can you teach me how to do D&Cs? And they said, well, what happens when you're not there? There's no backup or coverage for you. So no. So it's really an uphill battle, even for people like me, for whom, I think abortion is a human right, and pregnancy is a very difficult journey in life. There's a very decent chance, at least in the United States, that a woman dies during part of pregnancy and childbirth, and I feel like it's not a decision to be taken lightly. And if there's any reason that you want an abortion, you should have access to one. But even for me, feeling very passionately about that and wanting very much to provide that care, there are all these barriers, and so it's something that I've not been able to do.
Well, that's so frustrating as a rural patient too, because I don't even know where our closest abortion provider would be, but I'm guessing it's at least an hour and change away, and that's not,
I
that's not feasible. It's not.
um, yeah, I think Des Moines is the
And that's what,
closest.
four
So I mean,
hours from here,
yeah, 3.5, 4 hours.
more or less.
So yeah, and I've had to have this conversation with patients before who say, I want an abortion for whatever reason, and it's really difficult for me to counsel them about, well, you're going to have to drive hours and hours and hours away, or or cross state lines and drive hours and hours the other way. um, and so it's really challenging to know how to best counsel patients that want that, just because it's so difficult to access that. And the laws are changing constantly now, since Roe v. Wade was overturned. It's hard to keep, and we live in a corner of the state where we're very close to parts of Wisconsin and Minnesota, and so sometimes it's easier to get health care in a different state than it is to drive to some place within our same state where maybe the same service is available. But you really have to keep up on the laws because the laws are changing so quickly. It's in the on the in sorry the state laws are changing so quickly. It's hard to keep up with. Well, where is it legal? Where can I send you?
Yeah. Sorry. My head's going in a lot of different directions. And I know that my Canadianism is showing through because there's so much of the insurance side that I just don't understand at all, right? Like that doesn't compute, but I'm sure that
Neither do
yeah,
I.
for sure. And even the idea of writing a review of your doctor's appointment, that is not something I have ever come across. Yeah, but I mean, access to all health services by qualified medical professionals is something that people in rural areas, I mean, that's who we're talking to, but we understand the limits of geography and all those types of things, but being able to access the services we need when we need them is a human right, like you said, right? And abortion is included in those services that we should have access to if it's necessary for us. I'm going to go into the direction of the kind of the more parenting questions. So what is something that you wish you could tell us parents about our kids in terms of, like, not like the detailed medical stuff necessarily, but what do you wish that you could get through to parents when they're in your office, or the things that we worry about?
I especially when I used to do OB and deliver babies, especially first time parents were so nervous. Like, how am I going to take care of this little human when I bring it home? And what I told all of them, and I hope sunk in, is, infants need to be loved and fed, and that's basically it. Like, they're probably going to be fine if they are loved and fed. Like, that's it. And if you have a worry, you come to somebody who knows how to evaluate that worry. Like, those are the important things. It's not as important to have, all the fancy gadgets and things, and it really is, love your children. That's what you need to do.
Yeah.
um,
As they get older, I know that sometimes parents worry about, whether you're worrying too much or not enough, right?
mhm.
How do you help people decide when they do need more help, whether that's medically or developmentally, milestones, all that kind of stuff? How do you support parents who are in that kind of like, I'm just not sure, or I think something's off, but I don't know?
I mean, I may see your child, like, even in the early years when we're having a lot of appointments. I might see your child 20 minutes every few months, and you see them every single day. So I am, I have come across parents who are, maybe overthinking it or over worrying. But most often I find parents know their children best. Like, if you think there's a problem, probably there is. And, hopefully I can help you figure out, well, where can we get you help? What additional help do they need? There are a lot more services now than there were even 20 years ago for kids with developmental delays, chronic health conditions or problems. There's a lot more resources. And so, my general feeling is usually parents know their kids best. If you think there's something wrong, it at least bears further investigation. Um, and hopefully your family doctor can be the person to say, well, here's where I think you can get the help that you might need. So I consider that really to be my role.
And I know as a parent, something that has helped me is when you're not sure, or if you feel like your doctor is maybe going to be dismissive, is to have some documentation. Just write some things down, like really have a list when you go in, because sometimes you get in that office and you're like, I can't remember what it was I was actually concerned about. But if you have the list of things, you're like, here are the things that I'm seeing that maybe, are not the same as other kids, or not the same as my other children, or, that I'm noticing in these situations. Like, they might be more willing to listen to your concerns if you've got kind of a bit of backup, and also just that reminder to yourself to be like, these are my concerns. Like, don't let the office scare you into thinking, oh, it's fine. I'm sure it's fine. It's not really a big deal.
I think in general, a symptom diary for anybody of any age is the best thing to do. Like, if you have a concern, write down, like, this is the symptom I had. This was the day I had it. Like, these are the associated things. Because it is, there's so many things, and especially when it comes to, well child appointments, there are so many things that we want to ask to assess and make sure that that we're happy with how your child is growing and developing, and if they're meeting their milestones and so forth. So there's a lot of talking we want to do at you, and sometimes I think parents' concerns sometimes get a little lost in the shuffle. And so, yeah, I agree completely. Um, writing things down is the best way, I think, to really know. Because a lot of times patients will come to me with a concern, and they'll say, oh, well, this hurts. And I say, well, where does it hurt? When does it hurt? What happens around? And they say, oh, well, I don't know. And like, it's hard to remember if this is,
Right. And did it
something
start
that
6 months
is not.
ago or 6 weeks ago? I can't really remember what day or
Absolutely.
time, or, yeah, if I was doing a certain
So yeah,
activity.
writing down symptoms. Yeah, writing down symptoms is the best thing you can do.
I know, too, as a patient, one of the worst things is when you leave an appointment and realize that you forgot to ask about something or say something. And then you have to do things like Facebooking your doctor about the arthritis in your foot, which is embarrassing. But yes, I'm also a huge proponent of writing things down, because otherwise, I know for myself, especially with something with the kids, if I'm worried about it, it seems like it happens every day. Where if I actually write it down and then I can look back and be like, oh, it's actually only happening every 3 weeks. Like, it's just that I'm thinking about it, so it seems like it's an all the time thing. Or it actually is an all the time thing, but it doesn't seem like a big thing, so I'm not thinking about it. And oh, look, it is happening every day. Maybe I should concern myself with whatever this thing is. So, one of the big things, especially the last few years, has been physician burnout. And I'm wondering how, as patients and as community members, we can be supportive of our medical teams. Um, because you guys are really getting screwed from a lot of directions. And especially with things like the patient satisfaction surveys and that, it seems really unfair and shitty, because there's stuff that's not your fault and there's stuff that you cannot fix. I mean, it's just how it works. And, because we are in communities with each other and in small towns and we know each other, um, it seems that much more important to take care of people. And so I'm wondering how we can, besides, paying you in chickens or live basil plants that you can then kill yourself, how we can do better.
You know, I think I think honestly everybody is burning out right now. Um, not just the medical professionals. Like the last few years have been really difficult for people. A lot of the social norms that we had been accustomed to were completely upended. Um, there was a lot of socialization that didn't happen the last couple of years. So I feel like really everyone's burning out. I've started doing a thing I call joy prescriptions, where I tell patients, I want you to do something every single day for 5 minutes that brings you joy. And the number of people I get that say, well, I don't know what brings me joy is terrifying. Then I say, well, that's your first assignment then. Is figure out like something that brings you joy. And then you have to do it 5 minutes every day. And I really think that it's, just taking a little time to take care of yourself pays dividends in the long run. And, I know I, for far too long, just said, okay, yes, I will do everything. I'm going to do everything for everyone else. And you empty your cup, and then there's nothing left for you. And so the other thing I've started doing recently is saying no, and it's the best. Nobody says no enough. And I've just recently started doing it, and I love it.
Well, then I'm really glad that you agreed to be on our.
I agree to do fun things.
I said no to something recently too, and it was fantastic. So you have a project coming up, which I'm assuming probably brings you joy. You're starting a YouTube channel, is that correct? And what is it called, and what are you going to be doing on the YouTube?
I am. So we are, I'm in the process of making a Cooking with Dr. Coley channel. And this really stems from the number of times every single week I have to fight with people to eat their vegetables. in the Midwest,
I'm guessing it's not just the children.
Everybody tells me, well, we're meat and potato folk. It's not. No, I have like 70-year-olds with like really terribly controlled diabetes and heart disease, and well, we're just meat and potato folks. And I'm like, I just don't want you to have another heart attack. Like, really, can we, like, I'm not taking away the meat and potatoes, like, but could you fill half your plate with veggies? And people's idea of like a healthy vegetable is like iceberg lettuce with ranch dressing. And I say, well, I don't think that's the healthiest choice. So I'm really tired of having the same conversation over and over again. And I really love to cook. It's what I do for like stress relief. And I was going to offer a cooking class, but it turns out there's all these, like for my patients, but it turns out there's all these rules with Medicare that you can't give free stuff to people. And so I couldn't offer this class that I wanted to. And I just have all these like older Midwesterners who are just like so set in their ways, right? And not one of them wants to eat a vegetable. So I figured, well, maybe an easier way to get this message out broadly is to start a YouTube channel, and with just how to incorporate vegetables into your life, because people think that vegetables don't taste good. They think they're expensive, and that really just isn't the case. So it's going to be not entirely vegetarian channel, but like plant heavy foods, because I feel like that's what people have the most difficulty kind of incorporating into their diets. So really heavy on vegetables like beans and legumes, just kind of plant forward cooking to try to give people a resource to, okay, it's not, you can incorporate it. Like it doesn't have to be hard to incorporate vegetables. I won't even take away your meat and potatoes. Just like, please eat some broccoli sometimes.
So, as the wife of one of your patients who might believe that iceberg lettuce with ranch bacon bits and cheese on top counts as a salad, sorry, Jim, apparently it doesn't. Have you thought about maybe running like half a screen of tractor videos at the bottom of your cooking videos so that they'll watch them, or like interspersing little videos of cows in between to get them to like Or, oh, what's it called?
I
When
love this
you
idea.
when you put in like little snippets of something that like your brain doesn't consciously see. Um, like
Oh, like the
yes,
subliminal
yes.
messaging?
We'll just start putting it in all the tractor videos on YouTube. There will be subliminal messaging for like kale.
Perfect.
You know, all these farmers are going to start asking it for like tofu and curries and kale and shit. And everyone who cooks for these people is going to be like, what? All right, you know, it's going to be amazing. And my husband is doing better.
I think this is a
I'll
brilliant
say that
idea.
for him. He is making an effort. But yeah, I think subliminal messaging or some tractor videos might be the way to go. Because
I like it.
I think there is a real assumption that eating healthier means all tofu all the time and never eating anything that you actually want to eat again. And that's sad.
Mhm.
And also, not controlling your diabetes does really, really, really bad things. So, yeah,
Yes.
I think people miss what the fallout can be of that. So,
Uh-huh.
all right. And I watched your intro video and it was adorable. So we'll make sure to put a link in
Thanks.
so that people can watch you.
I just had we've learned some things during filming. So my husband is helping me with this. We are not videographers. We don't really know what we're doing. So we said we welcome feedback.
There you go. We ask all of our guests, if you were going to dominate a category at the county fair, what would it be? And categories can be real or made up to ensure that you win.
I mean, I make an excellent cheesecake, but those recipes aren't going on the channel.
That's only for the county fair.
I think I really could win a cheesecake making contest at the county fair. I really do.
But you'd probably put fruit on it.
Yeah, totally.
That sounds delicious. So we'll go ahead and move into our cussing and discussing segment. We've registered for an online platform called SpeakPipe where you can leave your cussing and discussing entries for us and we will play them on the show. So go to speakpipe.com/barnyardlanguage and leave us a voice memo, or you can always send us an email at barnyardlanguage@gmail.com and we will read it out for you. Katie, what are you cussing and discussing this week?
Well, I wrote down children are humans, but I do actually remember what I meant by this. It's so easy, and I am saying this as a reminder to myself, it is so easy to get so caught up in, my kids should be excited to go to school, they should do all their chores without ever talking back, they should do this, they should do this, they should never talk back or complain or want anything different or cause problems or whatever else. And I mean, my kids are just barely 6 and 4. And if I really think about it, if somebody pushed me around to do all the shit that I expect them to do without complaint, I would lose my mind. And, you know, the boy child this morning was saying he didn't want to go to school because he doesn't want to learn anything else. His brain is full. He's done. He wants to stay home and play tractors. He doesn't want to go to school. He doesn't want to, you know, he's done. And I'm sitting here thinking about, I'm trying to learn this new editing software for the podcast, and my brain is full after like 5 minutes of trying to learn new stuff. But I expect my 4-year-old to just trot happily off to school every day to learn more stuff. And, you know, it can take me an hour to get going in the morning and to get dressed and eat breakfast, but I expect them to be able to do it in 15 minutes when they don't get to choose what they're wearing or what they're eating or where they're going, and that they should just shut up and go do it and don't give me a hard time about it. And it is hard because on the one hand, just shut up and go eat your breakfast. You know, you're 4. I don't care what you think. But I do very much care what they think. And it's hard to balance caring and wanting them to feel like they have some agency in their lives with also knowing that sometimes you just have to shut up and eat your breakfast and go to school. And it's hard to take it too seriously when I know full well what he's learning in preschool. And it's not like they're, you know, it's not like he's in a military academy or something. So, anyway.
Yeah, it's a hard one to remember, though, especially when it impacts your, you know, you've also got in your head, like, if you don't leave now, we're going to be late, all the things that as adults we're keeping track of at all times, right? Like if my kids are going to miss the bus, then I'm going to have to drive them, like all the down the road consequences where you're just like, can you just do the thing? But yeah,
Just do it.
yeah. But they're also allowed to have feelings, apparently.
Apparently. All right. Coley, what do you have to cuss and discuss?
Oh goodness. Is this something that I think about that makes me want to cuss? Is that the point of this?
It can be. Yeah, this is just like, yeah, the random, either like the little tiny thing that bugged you this morning to like society at large, whatever. This is free reign.
Gotcha. I've honestly been really thinking about why is winter so long? I know this is something I can do nothing about, but we're only a month in and I'm sick of it already. And
Agreed.
this is also I just am thinking like, you know, can just the whole world just like move south during the winter? Just or shouldn't we all just like live in the temperate zone? I don't know.
Yeah.
Maybe I just need to do that.
Maybe.
Maybe I
Yeah,
just
that
need a
could be it.
vacation.
Yeah.
Maybe
There's
that's
something
the
about the
feeling.
longer nights too, the darkness. It's in the daytime when it's cold, I seem to be able to cope better, but like once it's dark and cold, then that's a harder pill to swallow.
I find that
I
interesting,
agree.
Arlene, because I prefer when it's dark because then nobody expects me to go outside. When it's light, I feel like there's some expectation that I might leave the house.
Yes, but like today I'm looking outside and there's snow, but at least the sun is shining. So it's like, I can look out there and think that it's not that bad. But yeah, when it's dark at 4 o'clock, then yeah, I don't want to do
Hmm.
anything, whether I'm inside or outside.
That's
No.
valid. So, Arlene, what do you
Okay.
have to cuss and discuss today?
So this one is semi like medically related, I suppose. And I'm not blaming anybody. It's
She's
just
got a
one of
rash to
those.
show you, Coley.
No, I do not. No. Um, it's just that thing where you call the doctor's office and you need to book an appointment and it seems semi-urgent to you and they're like, yeah, the closest appointment we've got is like 6 weeks or 2 months away, and you're like, well, I guess that's my only option. I will take it. But then, say that there's a prescription that needs renewed or any of those types of things, then there's all those extra hoops that you have to jump through where it's like, yeah, well, I don't have another doctor's appointment for another 2 months. So I guess you have to fax my doctor and or whatever technology they use now to talk to doctors. I think they still use faxes at my pharmacy. I don't know why they do.
They still use faxes. It's the most. That
Yeah,
is worth
the
cussing and
use of fax
discussing.
machines.
Why are we still
Yeah.
using faxes?
Yeah. Yeah. So then, yeah, that drawn out process of, okay, so yeah, I do have a doctor's appointment, but then the prescription is another whole thing. And yeah, just the delays. And I get it. Everybody's overworked. And sometimes you can't fit more appointments into a day, but I just don't like waiting for that kind of stuff. But
Can I pick a
absolutely,
new
get
cuss and
another one.
discuss? Because I think this is like understaffing of medical clinics, I think is a problem in many, many places, but especially
Mm-hmm.
rural places. It is ridiculously hard to recruit people to come work. And it does mean longer wait times for patients, and that your medical providers are overworked, and you still aren't getting to see them in a timely fashion. A lot of people in the U.S. will say, "Oh, well, we can't have a single payer system or socialized medicine because then care will be rationed." And I think what people don't understand is that care is already rationed. We just don't ration it in an intelligent or um, in a way that makes any sense. We're not
Mm-hmm.
deliberate about it. So instead, what happens is there aren't enough healthcare professionals, and where there are some mostly suburban type environments where there are plenty of doctors and you don't have to wait, but in the more difficult places to practice that have fewer resources, like rural places and like urban places, we are rationing care. We're just not talking about it.
Yeah. And it's probably not
So
being done in an equitable, across the board way, right?
no,
Where some people are maybe
not at
not
all.
seeing that it's being rationed because they're maybe in a different system than the other people who are waiting.
Yeah,
Arlene, I'm going
absolutely.
to add a second cussing and discussing too.
Bring it on.
You know, we have fun.
It's a double cussing kind of week.
This concept of the way the government controls prescription writing, if it seemed like it was actually fixing the opioid epidemic, fine. But this crap about things like not being able to get ADHD meds for more than 28 days at a time. If I didn't need meds to make my brain able to remember things, I might have a chance of getting my meds filled on time. But, there should be some route that if I can prove that I'm taking my meds, and I'm a 41-year-old mother, I'm not selling my meds to a bunch of, college kids on the street, I feel like I should be trusted with more than 28 days worth of medication. Or when, say, my insurance company refuses to pay for a prescription because they disagree with my doctor about what my prescription should be. Or pharmacies that second guess your prescriptions. Or anybody else. I just, if it seemed like it was fixing anything, it would be different. But we still have all these drug problems. And it's still a pain in the ass to get stuff filled. So that's my thoughts on that.
Well, and it's just it really is. I mean, it makes life harder for patients and for medical providers because, I mean, if somebody is stable on a medication, on their blood pressure medication, I will give them a month's worth with a few refills and say, hey, come back for a recheck in 6 months or whatever. But, I can't do that with the controlled substances. Like I need to write a new prescription every single month after you call in and request it. So it's harder for everybody.
Yeah, I think, that's exactly the problem, is that it's not in any way efficient for anyone involved. It's not efficient for the pharmacy either, because they have to,
No.
jump and do it when it does finally come through. And it's just a pain in the ass. Anyway. Arlene, did you have a second cussing and discussing you wanted to add?
I think I'm good for today. I feel like I'm going to, as a Canadian, I need to curtail my comments a little bit, other than saying, "Yay, socialized medicine." I know there are problems in the system, but I know that hearing the two of you talk about it and all the other stories that we hear from here, yes, there's issues in our system, but don't let your politicians and your insurance companies convince you that it's all that bad, because there's a lot of good that's happening, and I think that hopefully that if other systems are looked at critically and without all the biases and and often that comes from, that's where it's coming from, who's getting paid, right? So but look at what other countries are doing and actually make some decisions based on facts rather than believing the stories. Anyway, thank you so much, Dr. Coley, for joining us today. If someone wanted to get in touch or follow your YouTube channel, get in touch in terms of like asking for medical advice, but if people want to watch your cooking videos, where will they be able to find you?
So the channel is just called Dr. Coley. So like DRCOLEY.
That is great. We will look forward to watching them and see whether there's tractors involved or not.
Gonna add some now.
Maybe you could even just line some toy ones up on your counter. Or just some tractor books or something. We have some you can borrow if you need them.
There you go.
We got extras.
Great.
Thank you so much.
Thank you for joining us on Barnyard Language. If you enjoy the show, we encourage you to support us by becoming a patron. Go to www.patreon.com/barnyardlanguage to make a small monthly donation to help cover the costs of making the show.
Please rate and review the podcast and follow the show so you never miss an episode.
You can find us on Facebook, Instagram, and TikTok as Barnyard Language, and on Twitter we are Barnyard Pod. If you want to connect with other farming families, you can join our private Barnyard Language Facebook group.
We are always in search of guests for the podcast. If you or someone you know would like to chat with us, please get in touch. We are a proud member of the Positively Farming Media Podcast Network.